I'm Dr. Perry Godalovich at Phi Surgery, and I'm going to talk to you about the risks and complications related to blepharoplasty. We're going to start with the upper eyelid, which is the upper blepharoplasty. This is a fairly benign procedure where we're mostly removing skin and sometimes a little bit of fat. Because it's the eye, we're obviously very respectful and we're very careful in this area, but there is still always a risk of bleeding, or what we call a hematoma. In any surgery around the eye, we can also have bleeding that goes all the way back behind the eye. I've never had this happen. It's described in the literature, and if it's untreated, it can cause blindness. The risk of this happening is extremely, extremely rare, but it is something that we mention on consent forms when we're operating around the eye. The most common complications is feeling like your eye is not closing all the way down in the first couple of weeks after surgery and having some dryness related to the fact that we've operated around the eye. The scars usually heal very well, but every once in a while a patient will have a scar that is a little bit thicker, wider, or less aesthetically pleasing. These are often easy to correct. For the under eye, it's a little bit trickier, so there's a little bit different types of complications that can happen. What we do when we're doing surgery on the lower eyelid is that we're often going to try and tack it up during the surgery to prevent it from healing like this. Despite all of these maneuvers, sometimes the eyelid is going to relax and heal like this, in which case we'll have to correct it and retack it. That's probably the most common complication that I see, and it can happen usually in very heavy lower lids in about 10% of patients. Otherwise, you're going to have the similar complications, including dryness of the eyes, and those are temporary and have to do with the swelling around the tear ducts and usually dissipate at 1 to 3 months after the surgery. All the same complications as in the upper lid apply, including the bleeding and infection risks, and including also the risk of having bleeding behind the eye, which, like I said, is extremely, extremely rare.